Welcome to Ethics and Decision-Making in EMS, an essential course designed to strengthen your professional judgment and guide you through the complex situations you may face in the field. As EMS providers, we operate in fast-paced, high-stakes environments where our actions carry significant weight. Every call requires more than just clinical skill. It demands ethical awareness, critical thinking, and a commitment to doing what's right, even under pressure. In this course, you'll learn how ethical principles shape patient care, how to navigate moral dilemmas, and how sound decision-making fosters trust and accountability. Whether you're new to EMS or a seasoned provider, this training will help you make confident, responsible choices that reflect the highest standards of care. As EMS professionals, it's essential that we not only know how to save lives, but that we understand the why behind the decisions we make. In this lesson, we'll begin by defining ethics in the context of emergency medical services. Ethics in EMS refers to the moral principles and values that guide our actions, especially in high-pressure situations where lives are at stake and choices must be made quickly. Next, we'll explore key ethical principles such as autonomy, beneficence, nonmaleficence, and justice, each of which plays a critical role in how we care for our patients. Understanding these core concepts helps us provide fair, respectful, and responsible care in every call we respond to. We'll also review some common ethical dilemmas that EMS providers face, including situations involving refusal of care, patient confidentiality, and conflicts between legal obligations and patient wishes. These scenarios are often complex and emotionally charged, requiring us to think critically and act with compassion. Finally, we'll discuss sound decision-making practices. Ethical decision-making isn't about being perfect, it's about being thoughtful, informed, and consistent. We'll cover tools like the ethical decision-making model and the importance of documenting your rationale when you're faced with a tough call. Whether you're new to the field or have years of experience, reinforcing your understanding of ethics helps build trust, professionalism, and accountability, qualities that every EMS provider should strive for. Let's get started. Let's take a moment to define what we mean when we talk about ethics in EMS. Ethics is essentially a system of moral principles that guide our behavior, what we choose to do, how we treat others, and how we uphold our responsibilities. In emergency medical services, these principles aren't abstract. They directly influence how we care for patients, protect confidentiality, and maintain professional conduct under pressure. Every shift we work brings situations where our ethical compass is tested, whether it's honoring a patient's wishes, handling sensitive information, or simply choosing to act with compassion and respect. Ethics means doing the right thing, even when it's difficult, inconvenient, or goes unnoticed. It's about standing firm in your values, especially when the right choice isn't the easiest one. As EMS providers, we don't just represent ourselves. We represent our service, our partners, and the trust that the public places in us. Understanding and applying ethical principles helps us navigate challenging calls with clarity, consistency, and integrity. Ethics is not just about following rules. It's about doing what's right when no one is watching. When we talk about ethics in EMS, it's important to understand the four core principles that form the foundation of ethical medical care. First, beneficence. This means acting in the best interest of the patient. Everything we do, from the treatments we provide to the way we speak to patients and families, should aim to promote their well-being. Next is nonmaleficence, which is the principle of do no harm. This reminds us to consider the risks of our interventions and avoid causing unnecessary injury or distress, even with good intentions. Then there's autonomy, the obligation to respect a patient's right to make their own decisions. Whether it's accepting or refusing care, patients deserve to be heard, and their choices must be honored whenever possible. Lastly, we have justice, which is about fairness. We treat all patients equally, regardless of their background, insurance status, or personal beliefs. In the field, these principles help guide us through tough calls. When emotions run high, time is limited, and the right course of action isn't always black and white. When in doubt, these ethical pillars serve as a compass to help us provide compassionate, respectful, and equitable care to everyone we serve. As EMS providers, ethical practice extends beyond just making clinical decisions. It's reflected in how we carry ourselves on every call. One of our most important responsibilities is to maintain patient confidentiality. This means protecting personal health information and only sharing details with those who are authorized to receive them. It builds trust and complies with laws like HIPAA. Next, we must always obtain informed consent. Before we treat, we should ensure the patient understands what we're doing and why. Even in emergencies, respecting a person's right to accept or decline care is crucial. Another key aspect is to practice honesty and integrity. Whether you're charting a run report, speaking with a patient, or testifying in court, your word must be dependable. Integrity means doing the right thing even when no one is watching. Finally, we must avoid conflicts of interest. This involves recognizing situations where personal gain could cloud professional judgment, whether it's recommending a service for personal benefit or treating a friend or family member. As EMS professionals, our ethical compass should always point toward what's best for the patient, with transparency, accountability, and respect. These principles aren't just guidelines, they're the foundation of professional and compassionate pre-hospital care. Let's talk about some common ethical dilemmas EMS providers may face in the field. These are real-world situations where the right answer isn't always obvious, and your judgment matters just as much as your skills. One of the most frequent is the refusal of care by a competent patient. Even when someone clearly needs treatment, if they are alert, oriented, and capable of making their own decisions, they have the right to decline care. It can be frustrating, but autonomy must be respected. Then there's the issue of treating minors without parental consent. In emergencies, we're often allowed to act under implied consent, but the balance between protecting the child and respecting parental authority can be tricky. Another area we often navigate is end-of-life care and DNR orders. You may arrive at a scene where a family is asking for everything to be done, but the patient has a signed "Do Not Resuscitate" order. These moments are emotionally charged and require calm, ethical reasoning, and often, support from medical control. Finally, consider resource allocation during mass casualty incidents. When supplies and personnel are limited, we must prioritize care based on triage protocols, not emotion. That means treating those most likely to survive first, not necessarily the sickest. These are just a few of the ethical challenges that test our ability to apply principles like autonomy, beneficence, and justice in real time. Being prepared to handle these dilemmas thoughtfully and ethically is part of what makes you a true professional in EMS. When faced with an ethical challenge in the field, having a clear decision-making process can help you respond confidently and responsibly. The first step is to identify the problem. What exactly is the ethical issue at hand? Is it a conflict between a patient's wishes and medical necessity? Or maybe a situation where consent is unclear? Once the problem is defined, gather all relevant information. This includes patient history, mental status, legal documents like DNRs, and input from bystanders or family. The more accurate the information, the better the outcome. Next, consider ethical principles, autonomy, beneficence, nonmaleficence, and justice. Think about how your choices might affect the patient's rights, well-being, and fairness of care. If the situation remains unclear or emotionally charged, don't hesitate to consult with medical control or a supervisor. Seeking guidance isn't a sign of weakness, it's a step toward making the most ethically sound decision. Finally, once you've considered all angles, make and act on the best decision based on what's right for the patient and within your scope of practice. Document your thought process clearly, and remember, Your actions reflect your professionalism and your service. Ethical decision-making in EMS isn't always easy, but with a structured approach, you'll be better prepared to handle even the toughest calls with integrity. One of the most important ethical and legal principles in EMS is respecting a patient's right to make decisions about their own health care. This includes the fundamental right to refuse treatment, even when we as providers believe that care is necessary. As long as a patient is alert, oriented, and capable of making informed decisions, they have the autonomy to say no, whether it's to a specific intervention or to transport altogether. While it can be difficult to walk away from someone who declines care, honoring that choice is a cornerstone of ethical practice. When a refusal occurs, it's absolutely critical to document it thoroughly and completely. That means recording what the patient said, what care was offered, your assessment of their mental status, and any potential consequences you discussed with them. Whenever possible, have the patient sign a refusal form and have a witness present, ideally a partner or bystander. Good documentation protects both the patient's rights and your own legal liability. Remember, your goal isn't to force care, but to ensure patients are making informed choices and that you've done everything possible to educate them on the risks. Informed refusal is still a form of patient care. It just looks different than the typical treatment path. In EMS, protecting patient confidentiality is not optional. It's an ethical and legal obligation. We must always protect patient information, whether it's spoken, written, or digital. That means no discussing patient details in public spaces, no texting sensitive information, and no sharing stories that could reveal someone's identity. Information should only be shared with those directly involved in the patient's care. That includes your partner on scene, hospital staff receiving the patient, and dispatch or medical control if needed. Friends, family members, or bystanders are not automatically entitled to that information, even if they mean well. And it's important to remember that HIPAA regulations apply even in the field. Just because we work in unpredictable environments doesn't mean patient privacy can be overlooked. Your ambulance is an extension of the healthcare system, and your documentation and communication should reflect that same level of professionalism and discretion. A quick comment made at the wrong time or a careless entry in a run report can violate a patient's trust and potentially result in serious legal consequences. Keeping confidentiality at the forefront of your practice isn't just about compliance, it's about respect. Respect for the people we serve and for the responsibility that comes with our role. In the EMS setting, HIPAA, the Health Insurance Portability and Accountability Act, plays a crucial role in protecting patient privacy and controlling the flow of sensitive information. As EMS providers, we are legally and ethically obligated to safeguard all patient health information, whether it's spoken, written, or stored electronically. Under HIPAA, you may only share patient information with individuals who are directly involved in the patient's care, such as hospital staff receiving the patient, medical control, and other healthcare professionals actively participating in treatment. Sharing details with bystanders, family members, unless the patient consents, or posting about calls on social media is strictly prohibited and considered a violation. Even casual conversations among co-workers must be handled with discretion. HIPAA regulations apply in the field just as they do in hospitals, and breaches can result in serious legal consequences, disciplinary action, and a loss of trust from the communities we serve. Maintaining confidentiality isn't just about compliance. It's about respect for those who count on us during their most vulnerable moments. Ethical care in EMS also means being culturally and personally sensitive. As providers, we must respect the cultural, religious, and personal values of every patient we encounter. This could include beliefs about modesty, gender roles, end-of-life care, or preferences for who provides treatment. Even when those values differ from our own, they deserve the same respect and dignity we would offer anyone else. It's equally important to avoid imposing personal beliefs during patient care. EMS is not the place for political, religious, or moral debates. Our job is to provide care, not judgment. No matter how strongly we feel about an issue, professionalism means putting the patient first. Finally, we must be willing to adapt our communication and care appropriately. That might mean using simpler language for a non-native speaker, finding a female provider for a modest patient, or explaining procedures slowly and calmly to someone with different health literacy. Being flexible, open-minded, and respectful helps build trust and improves patient outcomes. In a diverse and dynamic world, cultural competency is not just a bonus skill. It's a core part of ethical, compassionate EMS care. Documentation is a key part of ethical EMS practice, and it's one that protects everyone involved. First and foremost, we must ensure our reports are accurate, honest, and timely. That means charting what actually happened on scene, without exaggeration or omission, and completing your run reports as soon as possible while details are still fresh. When you face an ethical challenge, such as a refusal of care, end-of-life issue, or a communication barrier, it's essential to record both the challenge and the rationale behind your decision. Include what was discussed with the patient or family, any consultations you made with medical control, and the steps you took to act in the patient's best interest. These notes aren't just paperwork, they're part of the patient's medical record and may be reviewed in legal, administrative, or clinical follow-ups. Good documentation protects both the patient and the provider. For the patient, it ensures continuity of care and transparency. For the provider, it shows that you acted responsibly, ethically, and within your scope. If something is ever questioned down the road, a well-documented report can speak volumes about your professionalism. Remember, if it's not written down, it didn't happen. Take pride in your documentation. It's more than a report, it's your voice when you're not in the room. Now let's go over a scenario. You and your partner respond to a call for a 62-year-old male experiencing chest pain. On arrival, the patient appears pale and diaphoretic but is alert and oriented. After your assessment, you strongly suspect a possible myocardial infarction, heart attack. However, the patient firmly refuses transport, stating he has things to take care of at home and does not want to go to the hospital. He fully understands the risks when you explain them. When faced with a patient who may refuse care, it's essential to respect the patient's right to make an informed decision. As long as the patient is mentally competent, they have the autonomy to accept or decline treatment, even when their choice may increase their risk. To ensure competence, EMS providers should perform and document a thorough mental status exam, confirming the patient is alert, oriented, and fully understands the situation. This evaluation should include assessing the patient's understanding of the risks, benefits, and possible outcomes of refusing care. Additionally, providers must clearly explain the risks and benefits of treatment and refusal, ensuring the patient is making an informed decision. This conversation should be well documented, including the patient's stated reasons for refusal and any efforts made to encourage treatment or transport. Upholding these steps protects the patient's rights and the provider's legal and ethical responsibilities. When managing a patient refusal, EMS providers should consider involving medical control or a supervisor if needed, especially in complex or high-risk situations. Consulting with medical control can provide additional guidance, ensure that the patient is fully informed, and support your decision-making process. Once a refusal has been confirmed, it is critical to document the refusal thoroughly, including all patient statements, your assessment findings, and the actions you took. This documentation should reflect the patient's mental status, the risks and benefits that were explained, and any advice or recommendations given. Comprehensive documentation protects both the patient's rights and the provider's legal and professional responsibilities, offering a clear record of the care provided and the ethical steps taken. Remember the scenario where you believe the patient is having a heart attack but he is refusing care? Here's an example of how to convey the importance of treatment and transport and ensure you're covering your ethical obligations to your patient.
Sir, I understand that you have things you want to take care of at home, and I respect your right to make decisions about your own care. However, I need to be honest with you. The symptoms you're describing and the findings from my assessment are very concerning for a possible heart attack. If that's the case, time is absolutely critical. The sooner we get you to the hospital, the better the chances are that doctors can restore blood flow to your heart and prevent permanent damage or even save your life. If you delay treatment, the situation could become much more serious very quickly, potentially leading to cardiac arrest or long-term complications. Right now, we can start treatments in the ambulance on the way, and the emergency department is fully prepared to continue care immediately upon arrival. Refusing transport increases your risk significantly. I want to make sure you fully understand the risks involved in refusing care, but ultimately the choice is yours. If you decide not to go, I'll need to document that you are aware of the possible consequences, and I would recommend having someone stay with you and calling 911 again immediately if your condition worsens.
In EMS, ethics aren't just a concept, they're the backbone of every decision we make. From the moment we arrive on scene to the moment we transfer care, our actions should reflect a strong ethical foundation. That means always striving to prioritize patient rights, safety, and dignity, no matter the circumstances. Even in fast-moving or emotionally charged situations, patients deserve to be treated with compassion and respect. And when we're faced with complex choices, those gray areas where the path forward isn't clear, it's essential to seek support. Reach out to medical control, a supervisor, or even a trusted colleague. Ethical decisions don't always have to be made alone. Collaboration can help ensure the best outcome for the patient and reinforce your own professional judgment. Lastly, never underestimate the power of professionalism. The way we conduct ourselves, calm, respectful, honest, and consistent, builds trust in the EMS system. The public, our patients, and our partners count on us to act with integrity. That trust starts with ethics. When you let ethics guide your practice, you're not just doing your job, you're upholding the values that make EMS a truly vital part of healthcare. Thank you for completing this lesson. We hope you found the course informative and valuable. Please proceed to the post-test to assess your knowledge of the topic. And thank you for visiting easyemsceu.com.